Good afternoon, colleagues. Am I clearly audible?
Yes, you are.
Okay, wonderful. I would like to welcome all of you to today's webinar. This is a webinar that is part of a series that is organized by the University of Botswana in conjunction with Botswana Partnership for Health, Botswana Harvard Partnership, as well as the Ministry of Health and Wellness. So we have these webinars every Thursday as a way to share knowledge and any skills and tools needed to respond to this COVID-19 pandemic in our country. So we have different speakers speaking every week. So if you want to be able to receive invitations to these webinars weekly, you can send your email to vindaba@globalhealth.rutgers.edu and you'll be added to the mailing list. These sessions are done over Zoom every week, and recordings are uploaded onto the YouTube page. So you have access to even previous recordings that you were not able to be a part of. And for those who have unfortunately not been able to join us today, they are able to also access this recording at a later date. So as the presenter goes on, you can add your questions to the chat function and we'll be able to respond to them at the end of the session. So that's the YouTube page where you can access this webinar as well as other previous webinars. There's also the COVID-19 the government portal where you are able to access different guidelines on COVID-19. We have about, within the document library, we have about 22 guidelines which you can access. As you can see there, we have IPC guidelines, we have contact tracing guidelines, and other guiding documents as well. So if you go onto that website, you are able to access those documents. Okay, so today we are joined by Dr. Violet Mathenge from WHO, who will be presenting on resurgence planning in COVID-19. So she'll be talking about the preparing, planning, and responding to the current and future waves of COVID-19 in Botswana, in line with WHO guidelines. So Dr. Violet Mathenge is a medical doctor and an epidemiologist with years of experience in public health in international and multicultural contexts. She's experienced in the planning, developing, and implementing of programs in the area of health security, including emergency preparedness and response. Her main area of interest is in the public health aspects of infectious disease control, epidemic and pandemic preparedness and response, with attention to the application of an all-hazard approach in the context of the IHR, the International Health Regulations. So Dr. Violet is currently serving as a surveillance and emergency risk management officer at the WHO Botswana Country Office. I would like to welcome her to the podium so that she can give us her presentation. Dr. Violet.
Thank you very much, Gomolemo, and thank you very much, the team from Botswana-Rutgers partnership for the invitation. Before I proceed, I am joined on the call by colleagues from the country office here in Botswana, as well as Dr. Alan Perry from the regional office, who will be possibly contributing to the discussions and the questions later on at the end of the presentation. So today, our topic for today is on preparing, planning and responding to the current and future waves of COVID-19 in Botswana in line with WHO guidelines. So just to give you a bit of a background, so since COVID-19 was declared a pandemic and declared a public health emergency of international concern on the 30th of January 2020, and subsequently declared a pandemic on the 11th of March 2020, it has continued to have widespread impacts around the world, causing major health and socioeconomic impacts. And this impacts have been seen all over the world, as well as in the African continent, where we are currently experiencing the third wave of the outbreak. So for the African continent in general as a whole, we are currently experiencing the third wave of the outbreak, which began towards the end of the month of May and is currently, hopefully at the peak of the third wave. So this picture is being seen pretty much across the African continent, with several countries such as Kenya, which is currently in its fourth wave, Mozambique, Nigeria, Ethiopia, Lesotho, Eswatini, as well as South Africa, which is currently at the tail end of the third wave. And really, Botswana is not exempt from the kind of picture that we are seeing. So this, I have an issue with moving my slides. Okay, thank you. So really, for any outbreak, and not just COVID-19, we tend to see that we expect an increase in the number of infections that are noted, that followed by a subsequent reduction in the number of cases if we don't even put any measures in place. However, if we put various strategies and mechanisms in place, then we are able to prevent surges in cases, and we are able to maintain low levels of transmission, hence what we talk about when we say initial flattening of the epidemic curve. So we put these measures in place so that we can reduce the magnitude of the outbreaks and thereby reducing the possible impacts of the outbreak to the society. So WHO has a three-pronged approach to mitigating the impact of COVID-19 within the continent. And this three-pronged approach entails shielding high-risk populations, containment of outbreaks, and prevention at source. And shielding of high-risk populations really entails protecting these populations that are at risk of serious illness. And this includes the elderly, the people who have comorbidities, as well as healthcare workers who we know are at the front line of controlling or mitigating or fighting the outbreak. The other approach is containing the outbreak, and this entails rapidly detecting the cases and diagnosing them. And when we do this, we quickly isolate them and manage these cases. This also entails tracing of contacts and quarantining them to try and prevent the spread of the disease. Prevention at source entails understanding where exactly do we have the hotspots, where exactly is the transmission taking place, and putting measures in place to prevent the transmission of disease. So in view of the fact that we expect waves and waves of the outbreak to continue, the WHO Africa region has come up with a guidance for COVID-19 resurgence, which is really to prepare countries to be able to plan adequately and to be able to respond to these waves of the outbreak when they take place. So the guidance on resurgence really has the outline as presented above. So there is an introduction section which just gives the overview of the epidemiological situation in the continent. There's a section on resurgence, which we will be talking a bit about today, which we will be defining what a resurgence is, defining the thresholds for early detection, defining what indicators do we need to use to be able to track resurgence in countries, and also how to integrate the thresholds into the IDSR reporting platforms. The other entity entails, after we have determined that we have a resurgence, then what actions do we need to put in place? What priority actions do we need to put in place to be at different phases of resurgences, and also a risk-based approach for adjusting public health and social measures. So what are the objectives and what is the rationale of having this interim guidance for resurgence? So the goals of this guidance is to be able to establish thresholds for alert and response to COVID-19. And the concept of thresholds is really not a new concept. Thresholds are markers that we use to help us to be able to know when an unusual situation is taking place, requiring that a certain action is put in place. Thresholds tend to trigger certain actions to show that the situation is unusual, and therefore we need to take some certain measures. And thresholds are not unique to surveillance. Thresholds are even used in the health sector, if I may say. For example, if we have any midwives on the call, they could know that we have, when we are monitoring labor, we have what we call the alert line and the action lines. These are examples of thresholds. They are markers that tell us that at this certain point in time, these are the actions that we need to put in place. These are triggers to certain actions being implemented. So the goal, one of the objectives, is to establish thresholds for alert and response to COVID-19 resurgence. And after we have established these thresholds, then we need to recommend what are the priority actions for the different phases of the resurgence, and to also recommend risk-based public health and social measures linked to various transmission scenarios. So what is the rationale of this guidance? Why really do we need it? In the African continent in general, we have weak surveillance systems, and we do not have an optimal testing capacity in most countries, really. And we are also seeing world over that we currently have the emergence of new variants of concern, which have been shown to have increased transmissibility. We also have a delay in rollout of the vaccine, and vaccine coverage in the African continent remains really low compared to the rest of the world. And this delay in the rollout means that there's an opportunity for new, even more resistant variants to emerge. Then on the other hand, countries have started to relax some of the public health and social measures because countries feel that they need to reopen the economies to continue to function. And as a result of these reasons, then we expect to see current and future waves coming in every so often because of these reasons. So for this, we need a guidance to guide us to how to prepare, how to plan, how to respond to all these waves when they occur. So for us to be able to address these resurgences, we need to have a plan in place. And how do we go about this? So number one, we need to define these thresholds. We need to say what is an alert and what is resurgence. We need to have some monitoring indicators in place to guide us to track whatever is going on. Number three, we need to come up with priority actions. Once we have defined what is an alert, what is a resurgence, we have indicators in place, we are tracking, then we need to see, after we have tracked, what actions are we going to put in place to be able to respond according to the current phase of the outbreak. These actions are based on an intervention toolkit that we are going to see, which is really based on the various pillars, the 9 pillars of COVID-19 response, with vaccination being one of the newest tools that are in this toolkit. And after this, we obviously need to have a continuous process of reporting and feedback so that we can be able to see what is the impact of our interventions and to adjust accordingly. So how do we define a COVID-19 resurgence? So COVID-19 resurgence is defined as an increase in new cases of COVID-19 after a period of low or no transmission for at least 2 consecutive weeks. So basically what we are saying here is that we have a period where we are seeing a reduction in cases or no cases, after which we begin to see an increase in cases. So if we have an increase in new cases, so if we have this scenario, then we can say that we are seeing a COVID-19 resurgence. And this definition makes an assumption that surveillance and testing are optimal, meaning that we are able to detect a good number of our cases on time, and we are able to test and therefore diagnose these cases. So we can confidently say that we are coming from a period of low or no transmission and heading towards a period of an increase in the number of new cases that are being reported. So we have these thresholds for early detection of resurgence, and we have 3 main actionable thresholds. The first one is the resurgence alert threshold. We have the resurgence response threshold, and we have what is known as a situation under control, where we are saying that we feel that the transmission of COVID-19 is under control. And we are going to have a look at each of these thresholds. So the first threshold is the resurgence alert threshold. So we say that we have a COVID-19 resurgence alert threshold if we are experiencing approximately 10 to 20% increase in the average incidence of COVID-19 cases using a 7-day moving average within a defined geographical area. So basically what we mean here is that we are tracking the number of cases that are being reported on a week-by-week basis. So we will track on a certain week to see how many new cases were reported, comparing this to the number of new cases reported in the subsequent week. So if we experience an increase in the number of cases that is between 10 and 20%, then we can confidently say that we are seeing that we have a resurgence alert. And we can only say this if in the previous period before, in the previous 14 days before, we had seen a decline in the number of cases, based on a 14-day moving average. So if we see we have a decline in the number of cases based on a 14-day moving average, and then we take the average number of cases in a specific week and compare them to the average number of cases in the subsequent week, and observe that we are seeing an increase in cases that is between 10 to 20%, then we say that we have crossed the resurgence alert threshold. And we have other indicators or scenarios that could constitute an alert over and above what I've alluded to. So if we observe the occurrence of 1 or more cases in high-risk populations, this includes old age homes, prisons, mines, and schools, and even cases among healthcare workers, we can say that we have a situation that constitutes a resurgence alert. If we also observe cases of ongoing transmission in closed settings, where we are seeing people sharing a space that is enclosed for several hours at a time, we can then say that this constitutes a COVID-19 resurgence alert. So the next threshold is the COVID-19 resurgence response threshold. So here we are saying that we are tracking to see, comparing 1 week to the subsequent week, taking the average number of cases, and if we observe an increase in the incidence of cases, this means that we are looking at the new cases per unit population, and we observe an increase that is greater than 20% within a defined geographical area, so maybe within a district or even within a village, then we can say that this is COVID-19 resurgence response. We are seeing that we have crossed the COVID-19 resurgence response threshold, meaning that we need to put certain priority actions in place. Then we have the third entity, which is under control. So we say that COVID-19 transmission is under control when we see that the increase in the new confirmed cases based on the 7-day moving average is less than 10% over a period of 2 consecutive weeks. So if we see that we have had either a decrease in the number of cases reported for a period of 2 consecutive weeks, or we observe that we have an increase in the new confirmed cases that is less than 10%. If we compare 2 subsequent weeks, then we can say that COVID-19 transmission at that point in time is under control. However, for us to classify a geographical area as under control, we have to take note that it does not meet the criteria for resurgence alert or resurgence response. So now that we have carried out the first plan of action, which is defining what our thresholds are, we can go ahead and identify which are these indicators that we are going to make use of to be able to track the number of cases that are being reported. And these indicators are very, very important because they help us to conduct an in-depth analysis of COVID-19 resurgence status for different geographical areas. And they're also very useful to help us to verify what we are seeing, because we are using more than one indicator, and to help us to continue to monitor the trend in the resurgence. So some of the indicators that we can make use of to track resurgence include the number of new cases reported per day. So we take the number of new cases reported per 100,000 population, and we look at the average of those cases and compare them on a week-by-week basis. The other indicator we can use is a percentage positivity rate. So this is a percentage of all the tests that have been conducted within a particular week. So we compare this figure to the subsequent week to see, are we experiencing a change, an increase, or a decrease? The other indicator we can use is active cases. So we take the active cases, which we calculate by taking the total number of confirmed cases in a specific week, and deduct the mortalities and deduct the recoveries. After that, we take that figure and calculate it per 100,000 population for a specific geographical area. So we compare the figure that we are seeing for a specific week to the subsequent week to see what is the change. The other indicator we can use is COVID-19 hospital admissions to see, is there a change in the number of admissions in our health facilities? Is there a change even in the bed occupancy in the health facilities? The other useful indicator is COVID-19 mortality, and we calculate the deaths due to COVID-19 per 100,000 population. And here we can also include the community deaths, the deaths that are being reported in the community, and make a comparison to see, are we seeing an increase or a decrease? The other very useful indicator is all-cause mortality. This is to mean mortality from any other cause, any cause really, and we compare this over time to see whether there is a change. So each of these indicators are subjected to that comparison, whereby we take the average number of cases on a particular week and compare them to the average in the subsequent week. And from there, we can calculate to see, is the increase below 10%? Is it between 10 and 20%? Or is it above 20%? If it is below 10%, then we can say that we are under control. If it is between 10 and 20%, we can say we are on alert. And if it is above 20%, then we can say we are on response. And each of these thresholds will trigger us to take specific priority actions. So this is what I just spoke to, that we can have 3 actionable scenarios, either under control, either on alert, or on response. And we have the traffic light system to say red represents a greater than 20% increase, orange would represent a 10 to 20% increase, and green would represent an increase that is less than 10% or a decrease. So now that we have identified what are our thresholds, we have identified what are the indicators that we are going to use, and how do we determine what phase of resurgence we are in, then we can come up with actions that we need to carry out based on the current phase of resurgence. And one of the actions that needs to be done is, number 1, on a continuing basis, we have to continue to track resurgence based on those indicators that I just spoke to. The other thing is that we need to identify and implement interventions that are stipulated in the country strategic preparedness and response plans. And these actions are going to be based on the state, the threshold that the country has crossed, or the district has crossed, or whichever geographical area that we are looking at. Then we need to do continuous monitoring and evaluation to see what is the impact of the interventions that we have put in place. Are they effective? Yes or no? Do we need to adjust accordingly? And then this is obviously followed by a continuous reporting and feedback mechanism. So each of the priority actions that need to be put in place are based on the various pillars of the COVID-19 response. And this is basically what is in the Resurgence intervention toolkit. So the various pillars comprise coordination and leadership, which is very important to enable us to achieve a coordinated and effective response. We have logistics and medical supplies. We have points of entry and environmental health. We have epidemiology, surveillance, and response, which is critical for timely detection and timely response. We have health system readiness and continuity of services, which is also very important to make sure that we don't lose on the gains that we have made and to make sure that cases continue to be managed adequately. We also have infection prevention and control, risk communication and community engagement, laboratory capacity, including genomic surveillance, which is also very useful to help us to be able to detect what are the specific variants that are driving the outbreak within the country. And the newest
Lucy, are you back?
My apologies. I'm gonna just start it where my network cut out.
Okay, please do that.
Should I try to share from my end? Thank you very much.
Okay, great.
Please move to the next slide. All right, thank you. My apologies for that. So it is very important. So countries have many countries in the African continent, including Botswana, are implementing the integrated disease surveillance and response strategy for early detection, for early warning and response to various priority diseases, conditions, and events. And this COVID-19 surveillance, it's very key for COVID-19 surveillance to also be integrated into this system for surveillance for COVID-19 to continue to be sustainable and for us to also have robust monitoring mechanisms. So it's very key for COVID-19 to be integrated into the list of notifiable diseases that are on the IDSR list of priority diseases, and also to be subjected to immediate and weekly reporting, as well as case-based investigation. Countries are also carrying out sentinel surveillance for influenza-like illness, severe acute respiratory illness, and it would also be important to integrate COVID-19 surveillance into influenza virus sentinel surveillance. So countries also continue to implement various public health and social measures. And as we know, these are non-pharmaceutical interventions. And it is very key for countries to take into account the epidemiological situation of the country while they institute the various public health and social measures. And given that most countries, Botswana included, are in community transmission, WHO has come up with a risk-based approach for adjusting these public health and social measures, which are based on the community transmission scenario of the country. So we have three main transmission scenarios, one being when we are at low or sporadic transmission, and this is evidenced by a declining trend in the number of new cases reported over the last 2 weeks, a declining trend in the positivity rate, a decline in hospitalization, as well as a decline in mortalities coupled by a high level of health system readiness. So if a country is at that level of transmission, then the measures that are recommended to be put in place is really minimum restrictions on movement, population movement, as well as keeping businesses and schools still open. But then if we move to the next transmission scenario, which is now moderate transmission, which is evidenced by a stabilizing trend of new cases at COVID-19 test positivity rate of between 5 and 15%, stabilizing trends of hospitalization and bed occupancy, as well as COVID-19 mortalities, then the country can begin to put in some moderate movement restrictions, as well as closure of some businesses and schools in order to be able to control transmission of the disease. And then if we have a transmission scenario that is high, where we are seeing an increasing trend of new COVID-19 cases over the last 2 weeks, we observe a positivity rate that is greater than 15%, an increasing trend of COVID-19 hospitalization, as well as bed occupancy rates, and increasing trends of mortalities observed over a 2-week period, coupled with a low level of health system readiness. Then the recommendation is to put in some population movement restrictions, to limit mass gatherings, to close schools and businesses, to be able to really control the transmission of the disease. So WHO has in place a three-pronged approach to response to the third wave, and this really is a balancing act, where on one end we have response to the resurgence, we have vaccination scale up, and we have ensuring that we have continuity of essential health services. And for the resurgence response, the key measures that are in place is enhancement of surveillance, mapping out of hotspots so that we can target interventions specific to these hotspots, carrying out of testing to be able to detect cases in a timely manner, contact tracing, management of cases, and putting in place public health and social measures that are adjusted based on the risks that I just alluded to. On the other hand, we have the vaccination scale up, where we're trying to make sure that we have plans in place, health workers are trained, and supply chains are fully functional so that countries can be able to scale up vaccination. And on the other hand is now making sure that health services are not stalling, and that we have a level of continuity of the essential health services. So for all this to happen, it is key to have stakeholder coordination so that we can have a seamless response, and also to have monitoring and evaluation mechanisms, as well as risk communication and community engagement, so that members of the community can also be part of the process. So in summary, drivers of upsurges in Botswana and the rest of countries in the African continent are multiple, and this include changes in human behavior. This includes, as a result really of fatigue to complying to the measures that have been recommended. Then we have a lot of countries relaxing some of the public health and social measures so that economies can really recover. Then we have a lot of festivities taking place. We have countries where we are having elections, other countries are having riots, and all these things are contributing to upsurges. And then we also have, last but not least, the new variants of concern that have been shown to be more transmissible and are becoming predominant in many countries in the continent, leading to upsurges in cases. And for this reason, there's really a need to plan to be able to deal with resurgences because we expect them to continue to occur, at least for the foreseeable future. And for this reason, the public health and social measures will need to be adjusted according to the level of risk, and therefore will need to be continually switched on and off. So therefore, what is really the way forward for Botswana is really to continue to maintain the capacities that are in place and to not lose out on the gains that have been made by strengthening the coordination mechanisms. The other way forward would be to make sure that the country finalizes the plans for resurgence that are in place and to operationalize these plans, particularly at the sub-national level, to be able to adequately respond to the resurgence in cases. And finally, it is key to sustain the capacity of the country to be able to characterize the variants of concern that are circulating within the country and that are acting as the primary drivers of the outbreak within the country. Finally, it is key to scale up vaccine coverage within the country to be able to reduce the level of transmission and the impacts of COVID-19 within the country. Thank you very much, and over to you, Gomolemo.
Thank you, Dr. Violet. Very insightful presentation. And that's a very good guidance from WHO. I believe it will help us as a country to implement our own resurgence plan. Before I go to the questions, are there any comments or additions from the other team members from WHO? Okay.
Good afternoon.
Good afternoon.
Yes, this is Kenzemwa Kufi. I don't know if Dr. Allen or Dr. Nambuzi, if they have any comments or additions to this presentation. But otherwise, from my side, I don't have anything to add.
Okay, wonderful. Dr. Allen, is there anything to add?
No, not from my side. I just appreciate the presentation and yeah, she has clearly highlighted the need to monitor the indicators. Those are one of the critical issues. I mean, critical components of this resurgence planning, and that's the only way you can know whether you are controlling the outbreak or whether your public health social measures are really working. So, and it's a very clear guidance that if followed, then this outbreak should be brought to, should be controlled in a very short period of time. So I'm open for any questions and clarifications if need be, but otherwise that's all from my side. Thank you.
Okay, thank you, Doc. I think we can now go to the questions. We have a question that was submitted during registration, and it says, how does WHO rate Botswana in terms of its strategic approach to addressing the upsurge in COVID-19 cases?
Thank you, Gomolemo, for that question. I think I'll request Dr. Mpire to take that one.
Thank you, Violet, and thank you, moderator. That's a very difficult question. We usually don't rate countries and member states in how they manage the outbreak. Usually, the data speaks for itself, and one thing that is sure is that Botswana is categorized as a situation of concern because of the high community transmission. we should all know that this is the new disease, and it will be very unfair to assess countries on how they have responded to the outbreak. However, WHO, what we do, first of all, WHO and MOH are one entity. So we provide the guidance and support the local authorities try and implement them. Of course, in some settings, the local authorities may opt, because this is guidance, the local authorities may opt to take the guidance or not to take not to take the guidance, and it's purely up to the member states. But I must say the Botswana has made some gains. However, they also have some shortcomings. We have not done an assessment. The activity that was close to an assessment was a collective activity, which was the interaction review, which demonstrated that there are gaps in some areas, and it did well in some areas, but it also did not do well in some areas, and it came up with corrective actions. So now it's up to the Ministry of Health to try and invest into those critical actions that they identified, because it was basically self-assessment, and they identified those critical actions, and they are supposed to implement them to better the response and also prepare for the upcoming upsurges and waves. So also, it's also advisable that the member states acknowledge whether they're in resurgence or not. So we categorize countries in resurgence and only if we have got a written documentation from the local health authorities to say we have begun, say, the second wave or third wave, and this is what we are doing. So that's how I would possibly respond to that question. They have made some gains, but also there are some areas where they need some improvement, as demonstrated and documented in the interaction review that we did some time. And I think they are trying to implement some of them, and hopefully, if they put brain power to them, they should be able to, to build some capacities and some mechanisms to respond to this outbreak and upsurge. Over to you.
Thank you so much, Doc. We have other comments on the chat. There's a comment from Dr. Gaolathe to say, this makes so much sense. Are we implementing the approach? It almost seems that we do not have a unified approach in terms of response. I think this speaks to the approach to resurgence, our response to the resurgence. So I don't know if you want to respond to that. Do you think Botswana is implementing the approach that's been suggested by WHO?
Thank you very much for that question. I believe that the country is, the Ministry of Health is in the process of working on its coordination, and also working on looking at the guidance and picking up key actions that need to be implemented based on the guidance. So really, I think that as Dr. Mpere put it, that the country is in the right direction, and we just need to make sure that we continue in the same trajectory. Unless there are any additions, colleagues. Thank you.
No, I think you and Dr. Ellen have really said it well. We are doing well, but there are areas of improvement. There is another question from Sydney Kololo, who's asking, he's saying there are a lot of issues surrounding mental health. Is addressing these issues part of the resurgence plan?
All right, thank you, Sydney, for that question. So if you remember, during the presentation, I an intervention toolkit. And this toolkit comprises the various pillars of the COVID-19 response, with, I mentioned the latest addition being vaccination. So one of the pillars that are within this response is case management, and psychosocial support falls under that element, and this would cater for the mental health aspect. So if followed, if we look at the key actions across each pillar, then it would be very evident that we're able to cater for mental health as well. Thank you.
Okay, thank you so much. Colleagues, I don't know if there are any other comments or questions. Okay. Now my question would just be, I realized that low vaccination rates is actually one of the factors that lead to resurgence, but we realized that there's an issue of vaccine equity in the world. What is your opinion when it comes to COVID-19 vaccine equity?
Thank you, Gomolemo. Yes, you make a valid point that countries in the African continent have received very few vaccines, and the coverage is very low compared to the rest of the countries in the world. So definitely this is an area where WHO is working on trying to mobilize and advocate for vaccine equity within the continent and pretty much globally. So I think that is one area that really is one of the reasons, as I alluded to previously, to say that we are likely to continue to experience waves of COVID-19, owing to the fact that we are quite far from achieving a good level of coverage of the vaccine administration. Over.
Okay. Thank you, Doc. Any other questions, colleagues, comments? Okay, great. Dr. Violet, thank you very much for that insightful presentation and the guidance really that's coming from the WHO office. It's very much appreciated. Dr. Gaolathe, may you please give us the closing remarks for today's session?
Thank you. Just to thank the presenters for today for this insightful presentation, and of course our Director of Ceremonies, Gomolemo. So we continue with our webinars, and we still ask from the audience on what topics they would really like us to have presented. But we do have our lineup in the next few weeks. Some yet to be confirmed. As we are all aware, with this COVID surge, we have received from the ministry that really they are going big on issues of home isolation and home isolation guidelines. So we are hoping to get a presentation on that in the next week or so. We will also continue getting our updates from the different DHMTs. And I think the Serowe DHMT would be next. I think with that said, thank you for joining us today. And we will meet next Thursday. Thank you.
Thank you. That brings us to the end of our session. Good evening.
Thank you.
Thank you.
Thank you very much. And this is Lebelonyani. So please, if you have anything to share, don't wait for us to to approach, just reach out any information that you want to share with the country. This is the best platform that can be shared. Thank you.
Thank you from Seki Tumile.